My name is Michael Paul. I'm the CEO of Lineagin. I'm also the president of the company, as well as a director of the organization on the board of directors, and one of the founders of Lineagin. So Lineagin has had great support since its inception. In fact, two of the founding, if you will, founding partners of Lineagin were Utah governors. The first was then Utah Governor Michael Leavitt, who became Secretary of Health and Human Services under the Bush administration. Subsequent to Governor Leavitt, Governor Huntsman, John Huntsman Jr., launched the company in December 2007. So we've had very strong support from the state. We have a very strong partnership with the University of Utah as well as with other academic medical research institutions. Lineagin is an organization whose mission it is to enhance and to accelerate the diagnostic evaluation of complex disorders. And we start with autism first, because we believe truly that there's a better way to diagnose autism and developmental delay. And in many disease conditions, you need a drug to change a person's life. And with autism and developmental delay, you don't need a drug. You just need a better way to have kids evaluated by physicians with the best tools and the best services that the medical organization has to offer.
I'm Dr. Stephen Michael Prescott. I go by Steve Prescott. I am the chairman of the board at Lineagin. I was one of the founders, the scientific founders, and have remained as chairman of the board. My day job, if you will, is I'm president of the Oklahoma Medical Research Foundation in Oklahoma City. Yeah, the topic of autism, of course, has been much in the news really for years now, but even more recently with this really remarkable report from the Center for Disease Control of an even higher estimate of the incidence of autism in our society. As we began talking with pediatricians and then specialists that they might refer to about how they would use a tool such as the one we provide for genetic risk in these children, we were pleased to find tremendous acceptance of it.
My name's Alex Lindell, and my current title is Senior Director of Product Management. I think the great thing about Lineagin is the decades of research that we were able to build this company upon. The Utah population database, the people at the state of Utah. So again, we got to just build on all of that work that was done before that. And then since then, we've been able to build a really exceptional team because we have access to what is probably the best genetic resource in the world, is the Utah population database.
My name's Galen Moffett, and I'm the Chief Operating Officer at Lineagin. And I was brought here primarily to take a concept and turn it into a business that actually produced a product that we could sell in the marketplace. First step is a very unique product in the market. It's what makes it unique is that it's a combination of two tests, Fragile X and chromosomal microarray, and the test is bundled, and then it has a service layer built around it. So what we're able to do is to take this product and use it with pediatricians and with other physicians who maybe don't have a completely full understanding of the genetics of autism or developmental delay, and by providing the service for them, we are able to act as their subject matter experts in this very complicated field.
We are driving the biological understanding of autism and developmental delay. So the technology we use is called microarray technology, or chromosomal microarray technology. The acronym for that is CMA. The registered trademark of the brand that we use is the gene chip. It's manufactured by a company called Affymetrix. We've partnered with them to develop a custom version of this microarray that has the highest diagnostic yield, or the highest resolution for what we're doing. If you think about it in terms of digital cameras, we're using the highest resolution digital camera that's possibly available.
The big innovation in first step buccal is that what we're able to do now is to collect the child's DNA with what's called a buccal swab. And before this, children had their DNA collected with a blood draw. And many of these children that are affected with these situations, taking a blood draw is very traumatic for them. And we've actually heard stories of moms having their nose broke by the kid rearing back in the chair as they stick them with the needle. And so for us to find a non-intrusive way that parents and the child could have their sample taken by just swabbing the inside of their cheeks, it would really take a lot of that trauma out of the situation. So we did develop First Step Buckle, and we introduced it to the market. It's been received with a great success, and if you couple that with our service package that we put around this product with our genetic counseling, it's just turning out to be a wonderful product for people, and every day we touch the lives of children and their families.
My name is Rena Vanzo. I'm the manager of the genetic counseling team here at Lineagin. There are 3 of us who are full-time genetic counselors here. We are licensed and certified. What we do here is we reach out, we provide support and education, not only to the families, but to their primary healthcare providers, so that they feel like they're getting more out of that genetic specialty visit. You know, what is the reason for it, and how does it fit in with their child's day-to-day life?
As we've developed the business model, we've started to offer it clinically, and you can see how patients use this information and how they change the way that the doctors are treating medicine. I mean, we're dealing with doctors that before we came along, they were afraid when they saw a kid with autism coming down the hallway. This is going to take forever. I'm going to have to give the parents bad news. I'm not going to be able to do anything for them. And now they're in a position where I think when they see those kids coming down the hall, they feel confident about, you know, their ability to be able to help that child.
We believe that offering this solution through an integrated genetic test, the best genetic testing services possible, with genetic counseling, personalized reporting, and a behavioral screening that the doctors can use at 18 months and 24 months, will all work synergistically to really enhance and accelerate that diagnostic evaluation process. And you can't really say that enough, because with autism and developmental delay, time does matter. Clinical research has shown that kids can be treated effectively as young as 18 months, and yet the current diagnosis for autism is 5.5 to 6 years old. I mean, that's a tragedy. To realize that there is unrecoverable time that's lost that could be used to treat a child, to provide them and their families with a better way of life.
My name is Bert DeMille. I'm the Chief Commercial Officer here at Lineagin. The results for the test for First Step. When First Step is run, our current diagnostic yield, if you will, is the term that's used in the industry, is about 18%, meaning we will have a genetic anomaly in roughly 18% of the kids that are sent to us for evaluation, okay? The interesting thing about this is that's today. That's generation 1. Generation 2, which we're due to launch in Q2 of this year, will take that diagnostic yield from 18 to almost 38%. And what that will do is it'll introduce a number of genetic markers on over 140 new novel genes that have been evaluated through the Children's Hospital of Philadelphia and the University of Utah. We'll be able to increase the yield of those findings up to about 38%. So that's nearly 4 in 10 kids at risk for delay or on the spectrum. We will be able to find a genetic association. That will be roughly double of any competitive chip on the market today.
The company has far exceeded its financial pro forma with respect to reimbursed price per test. The business model is strong with respect to the reimbursement rates. Sales growth has been terrific. Adoption by specialists in the field, real thought leaders, or for primary care pediatricians, really pretty much equally across the board with enthusiastic adoption. So we believe it's simply a matter of growing this business now. We're really at a stage of looking for growth equity at this point.
My name is Dinesh Patel. So we started a fund called V-Spring Capital in 1999. And today we manage over $400 million. And we focus on technology and in life sciences. So for us, when we look at a company, our number one criteria is the management team. Do we have a team that can deliver? So when we look at Lineagin, we found a team that was really solid. So once we find a team that's solid, our next question is, are you addressing an unmet need? When you look at autism, a family that has an autistic child, their life is totally turned upside down. I mean, even if they can just have a child that can be normal, and whatever that normal means, for half a day, it makes a huge impact for them. And with this diagnostic test, and if you give them behavioral therapy, children actually turn out to be functional and independent. So it's a huge, huge societal impact. And for us, you know, whenever you can do that in addition to generating revenue is always a big plus. That's how we got involved with Lineagin, and we've been extremely pleased with the way the company has progressed. The company already is marketing products. It's developing the next line of products in autism, and they're also going to develop other tests for children. And so we're very excited about our investment and our involvement with Lineagin.
I think with any successful startup company, you need to have passion. And passion is important because startup companies are difficult, they're time consuming. But I think the unique aspect of Lineagin is, in addition to passion, we all have a collective mission, and that's the purpose of the organization. And the purpose of the organization that we truly believe from the top to the bottom is to do good first.
One of the things that's the secret sauce, if you will, about Lineagin is the focus on developmental delay in autism. What we do at Lineagin is we specialize in developmental delay, autism only. We believe these are unique challenges not only for the pediatrician and for the parents. So rather than be a general tools provider, we focus on the disorder specifically. And currently we're the only provider out there doing that today. I think that makes us special.
The future of Lineagin is something that excites me tremendously, and I just feel an energy here all of the time. It just feels like everyone in this company is dedicated to helping families who have a child with autism spectrum disorder or delay. We all really care, and we believe in this company's mission.
So I think this company has the potential to be huge on its own, and I would not be surprised if we have 2 or 3 more tests that this company could go public. And again, continue to develop more products that will help children.
The people working at Lineagin aren't there just to get paychecks. They're late at night and determined to make this successful in a business sense, because if we're not successful in a business sense, we can't help people.